Today, we really want to focus on making sure that you're getting the most out of your mental health coverage and benefits. The Affordable Care Act required every plan to have 10 essential health benefits, and one of those is mental health, and we want to make sure that they can access the services they need. We want to welcome our guest today. Andrea is going to join us and tell us a little bit about her coverage.
Hi, my name is Andrea Ellis. My pronouns are she, her, ella. I am a student at the University of Houston studying political science. I am in the Young Advocates program at Young Invincibles. I believe that access to healthcare is a human right, not just an American one. I rely on health insurance for access to mental health and preventative care services such as therapy, prescription drugs, and regular checkups. Through my insurance, telehealth is covered 100%, so I'm able to schedule telehealth therapy appointments. It's very useful, specifically when you're dealing with something as hard as depression and anxiety. Some days I don't have the energy to get out of bed, and on those days I can set up an appointment if it's an emergency.
And have you experienced any issues when utilizing your insurance plans, specifically problem with finding providers within your network or getting access to appointments or anything like that?
I was able to find how to search for an in-network primary doctor, a dermatologist, a dentist, an optometrist to see which urgent care was covered under my insurance, and an OBGYN covered by my insurance as well. On the website, I was able to read through my schedule of benefits where it details my annual deductible, the co-insurance, the out-of-pocket maximum. It also lists what I have to pay when I see my primary care provider or a specialist, how much my prescriptions cost, and what services are covered. For those who aren't technologically savvy, all this information can be and more is available to you by calling the 1-800 number on the back of your insurance card. On my own, I was able to find out that my insurance covers Amazon Pharmacy. So I get my prescriptions delivered to my home, and Amazon will send me a monthly reminder, hey, you're about to be out of your medication. Do you want to put in an order? Or it's time to do refills, so they have to call my doctor to make sure that I'm getting the right one. And it's delivered directly to my home, so it's a lot easier. If you have the ability to get insurance, go on Marketplace. Look to see if you qualify for the credit to be able to pay less, because it's very beneficial. There's a lot of things that are available to you if you have insurance. If you are not able to get insurance, look for community health centers. More often than not, their wait times will be a little longer since they are servicing a lot more people, but they will be able to see you, and you probably won't need to pay anything for it.
Your work with Young Invincibles, I know that's an organization that we've done work with in the past.
Yes, we are currently doing virtual storytelling circles about mental health. You can go to our website, younginvincibles.org. There you will be able to find information on how to participate. It's a very trying time, so being able to talk to people who go through the same things you do and seeing that you're not alone helps a lot.
Mental health is an area that I think a lot of people maybe have come to recognize more, especially as we've gone through the pandemic over the last 2 years and how it has affected people's mental health. And we want to make sure always that people are taking care of themselves and taking care of their mental health. You raised a real good point with the telehealth and how that can be such a benefit. I know that's also true for people with mobility disabilities. Many times it's a difficulty getting to a provider, and utilizing those kind of things, I think, is also a great reminder of taking advantage of these things that many times providers and insurance companies will allow. Now that we've gone through the pandemic, they are willing to do a lot more of that stuff now. So let's make sure we're taking advantage of that to the degree we can. Thank you for joining us today, Andrea, and we'll look forward to working with your organization again.
Thank you so much. It's always a pleasure to be able to speak out about something that's so important to me.